Well, good afternoon, everyone. My name is Sean Egan. I'm the Director of COVID Workplace Safety here in the state of Michigan, and I'm going to talk with you today about some of the emergency rules and other things that we're doing to help contain COVID. As we've seen in Michigan, our case numbers are going up dramatically. Our positivity rate is quite high, and we really need to refocus our efforts on these mitigation strategies in our workplaces to ensure that we recognize that COVID is likely to come into the workplace, and we need to be prepared on how to handle that and some steps that we need to take to do that. So I'm going to try to talk for about 20 minutes and then turn into Q&A. So I'm going to go through this pretty quickly, but I will do my best to make sure that I don't go too fast. One of the things I can tell you that in the Department of Labor and Economic Opportunity with MIOSHA and the other things that we're doing, we truly are trying to get open and stay open. It's critical for working men and women and businesses to be able to conduct businesses to ensure that our economy stays strong, that people can earn a living and practice their trade or do whatever it is they need to do. One of the things that I bring to the table that I'm very proud to share with all of you that are paying attention today is that I am a state licensed journeyman electrician. I worked in the field for many years, and I bring a wealth of experience about things that we can be doing on the construction sites to ensure that we try to contain COVID. One of the things that is so critical is that we wear these face coverings. There's a lot of noise around COVID that we're all dealing with in the news. There is a flicker of light about a vaccine, but I have to tell you, we need to keep our heads down because it's going to be quite some time before that gets us to a safe place. Some of the things that have remained absolutely the same throughout the crisis is the need for social distance, wearing face coverings when we can't do that, and practicing good hygiene. A couple of the challenges with this virus is that about 40% of the spread is believed to come from those that are asymptomatic, which means they're never going to get sick. They're going to carry and transmit the virus, but they're never going to get a symptom, which means that face coverings and the social distance is that much more critical because the other 60% or so will develop symptoms and be spreading that virus around. So we know that when we had the stay home, stay safe order, the chance of transmission was practically none because none of us were at work. We were in our homes. We really couldn't do much. As we've started to re-engage in parts of our economy, wearing those face coverings and maintaining social distance is the next best. And then both of us wearing those face coverings is sort of still a low transmission risk. Both of us wearing those face coverings cuts that risk of transmission by about as much as 70%. And the virus, while you can catch it from surfaces, is largely spread through large respiratory droplets and aerosols that come out of us when we talk, sneeze, sing, you name it, that we're trying to pull back our faces when we wear those face coverings. And my face covering does offer some degree of protection, but it's primarily intended to protect you from me, not me from you. So it's important that we're both wearing those. And I know from talking with lots of people in the construction industry that at times on construction sites, we're not seeing as good of compliance with the face coverings as we need to make sure we really cut down that chance of transmission and make sure that our job sites stay up and running. In Michigan, we've been tracking outbreaks from the beginning. That includes workplace outbreaks. And in data that DHHS posts every single week on Monday before 3 p.m., we're continuing to see strong outbreaks across industries. Now, I don't include for this reference things like schools and colleges, childcare, nursing homes, and detention centers, because those are going to have a lot of non-employee exposures. Certainly still employees getting exposed and getting COVID, but that's going to have a lot of other numbers. So just to focus in on those workplaces where we know that it's more than likely employees getting COVID, we can see that the DHHS is continuing to track about 210 ongoing workplace outbreaks, and about 63 of those are associated with construction or manufacturing. And there were 93 new outbreaks in workplaces just last week, and about 28 of those were in construction or manufacturing. So we're a significant percentage of those outbreaks happening in the workplace. Now, the workplace itself does not have COVID. It's us bringing it in. So we really have to be diligent about those daily health screenings and other things that we need to be doing. And just for reference, about 17 reported outbreaks came from social gatherings in that same last week where we had 28 manufacturing. So I know that we're seeing COVID spread in our communities really fast, and we're having a lot of challenges, but it's getting into the workplace, and it's on all of us to implement those mitigation strategies, protect our fellow co-workers, and make sure that we can keep Michigan up and running. Now, our case rates in Michigan are very, very high, and our positivity rate across the state is about 14%, actually higher in some regions, lower in others. It's still off the charts, which means that it more than likely is going to come into the workplace, and we need to be prepared to handle that. So as you know, over the summer, there were emergency orders in place for quite some time that you were getting used to. On October 14th, MIOSHA issued emergency rules. MIOSHA covers pretty much every employer in Michigan with some exceptions, but by and large, every employer must adhere to these emergency rules. And as employees, you must follow the reasonable safety protocols as well. Employers need to make sure that they're enforcing those. There is a lot of consistency between those executive orders and our rules, and we have a lot of great information for you to understand that. And there is some overlap with the DHHS epidemic orders that were issued. What I would advise you to do is take the rules, which we expect to be pretty static for the next 6 months, get to know those, implement those, do the plans, and then layer in the pieces of the DHHS orders that might be more variable so that you understand where those might impact our construction industry as well. MIOSHA launched earlier this week with Press Today, a state emphasis program designed at construction. As I showed you with those case numbers and some of the complaints that we're receiving and calls that we're getting and questions we're getting, we thought it was important. This is an enforcement program. It's a proactive enforcement program where MIOSHA will randomly select construction sites across the state of Michigan and just stop in. They will not give employers a heads up that they're coming. They will announce themselves when they get there and conduct an inspection to see compliance with COVID-19 emergency rules. And some of the must-haves across Michigan, across employers in the construction industry, you must have a preparedness and response plan. If you haven't done one of those, we have a template that MIOSHA drafted on our website at COVID Workplace Safety that I'll mention in just a minute. It's right there. It's for low and medium risk workplaces, and that includes construction. So if you don't have it, grab that one. If you do, we're going to talk about a few of the things you're going to want to make sure you have in there. You need to identify COVID coordinators for each site, and they must remain there for the duration of the day. They do not have to be management, but they do need to be there to ensure compliance with the COVID rules. That includes the daily health screenings, wearing face coverings and other things, and be able to report back to somebody if those things are or are not happening. You have to be conducting those daily health screenings, which must include a questionnaire to check for symptoms and try to flag people that might have that, because the most valuable tool that you have in workplace safety is try to remove that hazard completely from the workplace. You need to be doing training for employees on how COVID spreads, how they enforce their rights, how they report signs, symptoms, and other things. You need to be keeping those records of training, daily health screenings, and some other things. And then we're going to touch briefly on a remote work policy, which for those in the field is not going to have much impact, but for construction employers, for your office staff, is something you're going to want to make sure that you're doing. So face coverings included in the MIOSHA emergency rules that apply to construction, similar to what you understand, that employers must provide those cloth face coverings or non-medical grade face coverings of some sort, that employees have to wear those when they cannot consistently maintain 6 feet of separation from other employees, and you must consider face shields when you can't maintain 3 feet or more of separation. So that's a face covering in addition to a face shield when people are working in close quarters. And the goal there is that that mask, as I mentioned, we're both wearing is about 70% effective. That face shield kind of helps incorporate that proximity to somebody else and cut down on further transmission. And then you always have to wear them in shared spaces. These would be hallways, restrooms, break rooms, in-person meetings. You have to wear those face coverings. So one of the questions that I continually get is about quarantine and isolation. This seems to be a call that I get pretty frequently regarding construction, and I want to make sure that we highlight it here to have this discussion. So employers are obligated to isolate any employees who are known or suspected to have COVID. This would include those that have symptoms but have not been tested, or are close contacts with somebody that was confirmed to have COVID. And you need to keep them out of the workplace. You need to get them away from the workplace, or you need to get them separated from the rest of the workforce until you can get them out of the workplace. And the way that quarantine and isolation works is we refer to CDC guidelines on quarantine and isolation. So quarantine is going to be for somebody that was a close contact with a known COVID case, and they're going to need to quarantine for 14 days from that last close contact. A negative test does not get you out of quarantine. Symptoms can develop anytime during that 14-day period, so you must quarantine them for that 14-day period. Isolation is when somebody has symptoms or they are confirmed, and they can be confirmed, meaning a positive test, and never have symptoms, and this applies. It's 10 days since their symptoms first appeared, or they had that confirmed test and symptoms never appeared, and that they have had 24 hours without, with no fever, without taking medication, and the other symptoms are starting to improve. Now, we do get a question about critical infrastructure quite often, and in the construction industry, that may apply in certain circumstances. There are potential alternatives in critical infrastructure industries only for that quarantine. If they have symptoms or they have a confirmed case, they still need to be isolated. If they have a close contact under very limited circumstances, there are some alternatives in the CDC guidance. We have a wonderful FAQ posted on how to get to that link and understand when that might be applicable. We also require employers to create a policy prohibiting in-person work for employees to the extent that their work activities can feasibly be completed remotely. So on a job site where you must physically be present to use your hands like we do in the trades to do the work, it's more than likely you cannot work remotely. But for contractors that have those office staff and others, you're definitely going to need to have this as part of your exposure or preparedness and response plan, or you can have it as a standalone document. It works either way. It needs to be a written policy. You need to identify which classifications or positions are reporting for in-person work and why they must be physically present, and then the reasons that that work cannot be performed remotely. And it needs to be specific enough to know that you've done a reasoned and thoughtful analysis of who must be in the workplace. When we're looking at 14% positivity, case counts as high as we have, you really need to focus in on getting people out of the workplace. We understand that there may be some, even in office settings, that have to be there in person, but you need to really get everybody else out the best that you can to help mitigate that potential spread. This is a further mitigation strategy, especially when we're seeing the case counts that we're seeing in Michigan, to try to keep those numbers down. You can find all of this information as well as that FAQ I mentioned, which has about 15 different FAQs. We've gotten a lot, covers on quarantine and isolation, remote work policies, and other topics that come up quite often at our website at michigan.gov, COVID workplace safety. We have posters, videos, and other tools there for you to use as well. There's a MIOSHA hotline for employees and employers to use if they have questions about the emergency rules or other workplace safety and health components related to COVID. You can reach that at 855-SAFE-C19. That'll get you directly into MIOSHA. The wait time has been 30 seconds or less throughout this crisis. It's a great tool and a resource for you to better understand the things that you need to be doing. We have some consultation programs in place. You've probably seen news about the Ambassador program. This is a proactive consultation program where consultants will just stop in at certain types of businesses. That is more focused on those open to the public establishments like restaurants, bars, and gyms. But we've always had a great consultation team at MIOSHA that's available. You can find a link for them on the MIOSHA website, and they can do consultations with you on your plans and protocols. They can do that off-site, they can do it on-site, they can work with you via email on some components. So make sure you're taking advantage of those resources so that we can help contain COVID. We have links to a lot of great websites there on that daily health screening protocol. The My Symptoms app was created by DHHS and the University of Michigan. It's free for employers to use. You can download that. You'll get an employer-specific code. You tag that code with your employees when they enter their information, and their information and questionnaire will come back to you. You have a real-time dashboard, and they'll also get a flag on their smartphone or whatever device they're using to fill out the questions on if they flagged for COVID symptoms to try to keep them out of the workplace. So just a couple of other quick points that I'd like to make is that I understand in the trades that it's hard. This is how you make your living, is by going to work. Sick time or paid leave might be non-existent in some places. If you are covered by the Families First Coronavirus Response Act, you might have some pieces there. If you do not have paid sick leave, you can get unemployment during that period that you need to isolate or quarantine. But I know that we have a culture of going to work no matter what and bringing that illness into work. And I know that it creates hardship for us to miss those paydays. But you need to do that to protect the job site and to protect your coworkers the best that you can. And employers need to take that serious, as hard as it can be. We have to get through COVID, and we need job sites to come back too. So if you do have to miss a couple of weeks because you need to quarantine, you need to make that happen. So with that, I will just turn it over for the question and answer period.
All right, thanks, Sean. I'll dive right in. The first question asks, what are the rules for employees from different households riding together in a company vehicle? Do they just have to wear a mask at all times?
So they would need to wear a mask at all times. I would encourage the employer to find alternative ways to transport those people so that we're not creating that potential exposure risk. They should also have the windows cracked so that they can maintain certain better indoor ventilation in there. You should have the recirculation shut off in the vehicle. All in all, I would highly encourage that employer to make sure that they do not have more than one person riding in the vehicle to the maximum extent practical.
All right, and the next question is from, I believe it's Kiddo. I work for a grocery store that is undergoing a remodel currently. We have contractors in and out throughout the day. My question is, do the requirements for construction sites apply to these workers? Should we treat them as employees in terms of health screening, mask requirements, etc.?
So if they are an independent contractor hired by your employer to do a certain project, the responsibilities would fall on that contractor employer. But I would mention that DHHS, depending on what type of environment they're in, if it's open to the public in a retail store, those employees likely need to abide by some of those DHHS pieces as well, which means you're wearing a mask all of the time. So they definitely want to consider that.
Thank you. And the next question is from Randall Whitaker. Busing workers to job sites, are there any guidance or requirements when general contractors don't allow parking on site and contractors are forced to bus in workers? This is obviously a huge health risk to construction workers.
So similar to what some of the rules we would see almost for public transportation, I think we would anticipate seeing there. They're going to need to make sure that they are maintaining social distance on those buses, that people are wearing masks when they're on those buses. They're going to need to leave those windows down and really identify any other mitigation strategies that they can to mitigate the risk of spread on that bus environment. I would encourage employers to really think about how they're navigating that to contain COVID, especially with our numbers. And I would hope that employees are doing their daily health screening protocol before they get on that bus.
All right, our next question comes from Dave. Are there any special steps which need taken if an employee is exposed to someone who is known to have been recently exposed to someone else who is currently infected with COVID-19? In other words, the employee was not directly exposed.
So one of the things that has to happen, and why I highlighted it, is that that employee that was exposed to someone that had COVID-19 should be off on quarantine and should not be on the work site. For those that are closer to that, a couple of layers down the line, I think it would depend on those close contacts and other things. So until that exposed employee is removed from the work site, I think the employer is going to be in a position now that they're going to need to monitor those that were around them in the event that they develop symptoms in the next few days, or week or so.
Okay. And are there restrictions in construction regarding the number of persons in a 1,000 square foot area?
The capacity limitations do not apply to those industries like construction and manufacturing that you've seen in the DHHS order. But the employer is going to need to make sure that you can maintain social distancing to the maximum extent practical. They're going to require that you wear face coverings. If you're within 3 feet, they should be requiring face shields as long as they don't, in addition to the face covering, as long as they don't create an additional hazard. They need provisions for cleaning and sanitation, how people are getting in and out so they're not congregating. There's going to be a lot of things that employers really going to want to think about on the number of people that they'd have in a space that large.
All right. And when employees go to a job site for field work, do they need to complete a daily health screening like office employees do?
Yes, that has been the same throughout this crisis, and they need to be conducting a daily health screening protocol either at that job site or using something like the My Symptoms app.
All right. And is it the responsibility of the employer or business where the field work occurs to complete that health screening?
Yes. Yeah, the questionnaire itself can be a form that you give to the employees, but they're going to report that back to the employer. The employer needs to see that so that they can remove people from the work site if they have symptoms of COVID. So yes, the employer is going to have a role in that process.
All right. And do we need to log COVID cases on our MIOSHA 300 forms at the end of the year?
Yes, there is some enforcement discretion, and I'm not sure if we've posted an FAQ yet, but it comes in. But under federal OSHA's guidance for field enforcement, which MIOSHA is using, there are some reporting requirements for COVID on the 300 form.
All right, our next question is from Cassandra. Do we have to put a copy of our workplace preparedness plan on each job site in hard copy form?
You can use an intranet as long as your employees have access to it on those job sites. Some do, some don't, depending on what type of setup that you have. If they can access it from their smartphone, I would encourage you to consider that for sure. Employees do need to have access to that preparedness and response plan, and they should be trained on it as well.
All right, and you mentioned the COVID coordinator must be present for the duration of the day. Does this mean this responsibility cannot be split between multiple staff or in shifts?
No, it can be split. They just, a COVID coordinator needs to be on that worksite location for the entire shift that people are there. And if you're going to split that, half a day, if you want it by sections of a job site, all of that is fine. Employees need to know who that is, and that COVID coordinator just needs to know what they're watching for and who they're reporting to.
All right, and oops, sorry, my screen just switched on me. The current orders mention limiting the number of people in an indoor construction space based on size of the space. Is there any guidance on this?
I'm not sure which order the person is referring to. The MIOSHA rules do not have a limitation on how many people would be in a space like that, and the DHHS order issued on Sunday does not include construction sites. If they're working in a commercial setting where they're remodeling, like the earlier question, a store or something like that, they may want to take those into consideration.
All right, our next question is from Michelle. Are there any requirements for reporting positive COVID cases to MIOSHA?
No, the employer is obligated to report positive COVID cases to public health. They're also required to, within 24 hours, notify any coworkers, visitors, or other contractors that may have been a close contact.
All right, and what constitutes an exposure that warrants quarantine? Is it 12 to 15 minutes of close contact, brief in passing? With how widespread this now is, one can imagine an entire work site being shut down if only brief exposure is the mechanism.
So close contact is defined as within 6 feet for 15 minutes or more. That 15 minutes is cumulative. From MIOSHA's perspective, because you may not be able to track how many interactions that you had, you'd probably want to notify people working in that area to determine if there are close contacts that you may or may not know about. And that is a 15 minutes cumulative in a 24-hour period.
All right, and is exposure only applicable when a positive person is not wearing masks? If both parties are masked and one is positive, is that an exposure?
Yes, the CDC specifically, the guidelines that we point to in our emergency rules as it comes to quarantine and isolation, says specifically that cloth face coverings are not considered in determining the 15 minutes or more. The reason for that is, as I mentioned, they're about 70% effective if we're both wearing them. Obviously, 70% is not 100. So you could still have that exposure while you're wearing those face coverings.
All right, and our next question is from Gabe. How long should we be keeping the records of questionnaire forms?
1 year from the time of generation.
And we created our COVID-19 plan in the spring. Can we update it, or should we create a new one? I think this says compiling to OSHA, MIOSHA, state, MDHHS, and local health department.
I would encourage you to update it.
And who informs the health department about positive COVID individuals, workplaces or healthcare provider?
Workplace, if the workplace finds the positive, they're going to have to report to the local public health. So if I came into work and I started showing symptoms, you need to get me out of there, and then I take a test and it's confirmed, you're going to report that to local public health departments.
All right, and Alan is asking, if the company where the construction work is being conducted requires their own COVID health screening, does the worker need to go through the screening even though they may have gone through their own company screening?
Yes, certain, having been in the industry, I understand exactly what that question is that sometimes customers of contractors will have their own protocols that we have to follow as construction workers. And yes, if they have that type of setup, more than likely you would have to take both.
All right, and why would a negative test result not release an employee back to work?
If you are quarantined because you were in close contact with a confirmed case, meaning you're within 6 feet for 15 minutes or more, you can develop symptoms anytime in that 14-day period. So if just think of that, if you took a test a few days later, and it was negative, you can still be carrying the virus. It's just not to the point where you're sick and you're going to develop symptoms later.
All right, and are general contractors responsible for subcontractors on site, or is each company responsible for their own employees?
I've actually seen that work a couple of different ways in the industry and have talked directly with tradesmen and employers on how they're managing this out there. Some construction sites are more cohesive, where the general contractor might be doing the daily health screening and some of the COVID coordinator functions. If that's not happening, each employer is going to have to do that themselves.
All right, and what is the guidance on when to shut a job down according to MIOSHA?
MIOSHA doesn't offer guidance on when to shut a job down, but I think employers have to, depending on what's happening on their job site, how many people are sick, if they're getting sick, are they quarantining and isolating correctly? The point of the mitigation strategy is to try to keep COVID out of those workplaces. So it's my belief that if you're really being quick about isolation and quarantine and doing the right things, that you can likely keep your job sites open. But certainly with our case numbers as high as they are, you're going to want to think about your processes and procedures to spread people out the best that you can, require those face coverings, do those daily health screenings, and getting COVID out of there as quickly as possible.
All right, we work in the siding industry. What requirements do we follow as we are outdoors?
So you're going to follow the emergency rules just like anybody else. You're going to require those face coverings if you can't maintain 6 feet of social distance. And this is a place where we have seen citations over the summer in certain residential or smaller, not smaller, siding could be huge. Even if you're outdoors and you can't maintain that social distance, you need to wear those face coverings.
What notifications have to take place and if an employee gets COVID-19?
The employer is going to need to notify local public health as well as any other employees that may have come into contact with that person, and contractors and other suppliers and things of that nature. But the goal the goal there is to recognize and try to identify if that positive case spread to somebody else at that point and start that quarantine and isolation process.
Perfect. And let's see, with winter weather arriving, some construction sites are challenged with providing running water or standalone wash stations for hand washing. Will hand sanitizer alone be acceptable?
Yeah, to where in those places that you can, certainly running water is the preferred method, but hand sanitizer as an alternative is acceptable.
And would a construction management site superintendent meet the requirement for a COVID coordinator for that site? Or does each trade have to have an acting coordinator?
No, that'll work fine. I think the distinction we like to make is that it does not necessarily have to be a management representative, but depending on how you're structuring your job site, if it's the superintendent, as long as they're capable of seeing and identifying compliance with the emergency rules, that is acceptable.
All right, and this one's from Neil. Are employees working on transmission lines and/or traffic signals considered critical infrastructure employees and allowed to return from quarantine prior to 14 days from their last close contact?
We would have to review the CISA document, which lists critical infrastructure industries. Certainly some utilities and other types of workers might be in that position, but it's not that simple. Being designated as a critical infrastructure industry is not a free pass on the rules, nor is it a free pass on potential differences in quarantine. It depends on the nature of that employee's work, the ability of the operations to continue without them, and several other factors that employers are definitely going to want to make sure that they pay attention to. And as I mentioned, we do have that FAQ up on our COVID workplace safety website.
Perfect. And Sean, how would you suggest people handle cases where someone refuses to leave or refuses to be tested?
So if somebody is identified with symptoms, or they are a confirmed case, or even if they're a close contact, they need to be separated from that work site. I would encourage employers to help that employee with the unemployment system. If that is their payment method, make sure that employers are providing that paid leave benefit if they're required to by the law. Understand that there are some protections against retaliation if that person does need to be off, but do what you need to do to manage that situation for sure.
All right, and this one's from Sherry Smith. Can you explain the changes in essential versus non-essential?
So when we saw the stay home, stay safe order earlier in the year, it identified some essential and non-essential types of workers. The distinction now is really based on that critical infrastructure document by CISA. It lists some particular industries which are intended to identify those workers that their work is so critical to maintaining our daily lives that in certain cases they may need to work regardless of the stay home, stay safe, stay home, stay safe, but as it relates to that quarantine issue. So that you can find a link to that document or the CDC guidelines, at least on that FAQ that I mentioned, to really get a better grasp on what industries those are and what types of workers those may be.
All right, and what risk level would COVID cleaning fall under? There's no direct contact with a positive patient or other people, and proper PPE is used.
So that one, depending on the setting, I'm going to assume that we're talking about construction sites. So if you're COVID cleaning, there are a few steps that you can take. One is to let that area air out, so to speak, if it's possible, so that the virus, if it's aerosolized, has time to settle and those types of things. And then you're more than likely going to need to wear the face covering for sure, and potentially gloves or something, but an employer should make a determination based on the space. So it's hard to give a general answer because construction sites can vary so much. If it's the break room, if it's this one particular work area, and the types of things going on there. Included with that, though, is that employers should be trying to mitigate sharing of tools, making sure that shared tools are cleaned regularly, and those types of things.
All right, and if someone is quarantined for 14 days, do I need to require a negative test for them to return to work?
No, the testing requirements required by the CDC are primarily related to healthcare, typically, or in the CDC guidelines as it relates to testing for non-healthcare environments, even other critical infrastructure type workers, a negative test is not required to return to work, even for those that had a confirmed positive based on that time period of 10 days, fever's going away, other symptoms are improving.
And Jordan asks, if somebody I live with tests positive for COVID, when should my quarantine begin?
Your quarantine should begin immediately upon having close contact with that person. And if you live with them, certainly that's more than likely to occur. If you are somehow in your house able to separate yourselves, where you're not going to have that 6 feet for 15 minutes or more and that kind of stuff going on, it is possible that you might be able to return to work after 14 days from that last close contact. If you're caring for that person, it's going to be 14 days from whenever that last close contact occurs.
And what if a company can simply not afford to set employees up for remote work?
The company is going to want to look at a host of factors. It could be rotating schedules. It might be limited remote work. Just take a look at the activities that people do and try to identify those that may require some type of physical presence versus those that they can do remotely. That might be coming in 1 day a week to pick up work to take home. There's a lot of alternatives out there to make sure that they can try to get folks out of the workplace.
And is the general contractor required to supply PPE equipment, or is that the responsibility of the individual trades?
It depends on the general contractor and the contractors. Under MIOSHA standards, if you're talking about personal protective equipment, employers do have to provide that. They also have to provide the cloth face coverings or non-medical grade face coverings.
And as a drain cleaning and plumbing company, we frequently have technicians going in and out of homes. How would you recommend us to move forward with these policies?
So if they go into the rules, there are some specifics for in-home services and things of that nature where they're going to wear masks more often, making appointments with those customers, doing the call ahead screening of that customer to make sure that they're not having COVID symptoms or something like that in their house, trying to make sure that while that contractor is in there working, that the customers stay away from them to the extent practical. We all know, having worked in homes, that it's hard to get customers to do that at times, but doing everything you can to try to keep them away. And in non-emergency situations, if you can, just don't go in there if it looks like there's going to be some potential hazards to the employee if they have symptoms or they have COVID or something like that.
All right, and are contractors required to obtain screening records from general contractors if the general contractor is completing the screening?
They should absolutely have those, because if MIOSHA is conducting an investigation, whether as part of our state emphasis program or a complaint on that subcontractor, they're going to ask for those records.
All right, and this question comes in from Megan. Where can we find a sample remote work policy?
The remote work policy can be part of your preparedness and response plan. We have not created a template policy for that because every employer will be different, but if you use the FAQ posted on our website, that should be able to guide you through the steps that you're going to need to have included in that plan.
And are employers required to pay for the testing or the time it takes an employee to get tested?
That depends on the circumstances and would be governed more by the Fair Labor Standards Act and some other workplace protections. So we'd have to navigate that on a more of a case-by-case question.
All right, and this question comes in from Teresa related to remote working. Are we required to provide internet service to those that do not have the service at home currently in order for them to work remotely? Also, that
would be one of the considerations that you'd want to include in your remote work policy.
All right, and then she added, if they are unable to get service at their homes, are they required to work from home?
So without answering that as a blanket for everybody, but that would be one of the feasibility determinations that would make it more likely that that person could be in the workplace.
All right, we have our last question here, Sean, and that is, what if your COVID coordinator has COVID and is in quarantine?
Then you should get another one.
All right, that's all we have for the questions today. Sean, go ahead and close us out.
Well, I appreciate everybody taking the time. We definitely ran over with the questions, and I appreciate that. It's hard to get to them all at times. It's nice that we were able to get through so many of them. I know that there's still probably tons of questions. You can use the hotline I mentioned, 855-SAFE-C19. Definitely check out our FAQ. That'll probably have answers to a lot of the recurring questions that you're getting or having out there in the workplaces. Our numbers are high. We have a problem here in Michigan, and we have to work together over the next several weeks to get that down. We knew from the scientists that heading into the fall it could get bad, and right now our numbers are really, really high. So it makes it more likely that COVID might come into the workplace, and we have to be diligent about keeping it out. And as tradespeople, we have to be respectful to our fellow tradespeople that, it's hard for us to take time off. We don't want to shut that job site down because we need a job to go back to, and we don't want to create that hardship around. So if we do need to quarantine and isolate, like I mentioned, you can qualify for unemployment benefits. If your employer is covered by the Families First Coronavirus Response Act, you may qualify for some paid leave. There are some workplace protections for the need for leave. So make sure you're taking advantage of that. And employers, there are tax credits available to you to help offset that if you're covered by the FFCRA that you would want to check out. Construction is a challenge. We are seeing any place that people can congregate as a challenge, and we really want to work to get these numbers back down to make sure we're continuing to move Michigan's economy forward, and that we can truly continue our mission of getting open and staying open, ensuring that working people can work and business can do business, so that we can all keep moving ahead. So I appreciate everything you're doing. Make sure you keep up the good work. The industry is critical to Michigan's health, and we know how to be safe. We know what PPE is, and we know how to protect each other. So let's make sure we do that, and let's get our numbers back down to a more manageable range.